Thank you for your service.
Thank you, sir.
We'd certainly appreciate it. Floor is yours. Please identify yourself for the record. And
My name is Thomas Vance. I'm a retired disabled Air Force Master Sergeant. I'm a lifetime member of the VFW, and I am the senior advisor and a member of the group Veterans for Medical Cannabis Access. As a member of the Veterans of Foreign Wars, I authored a resolution that the Veterans of Foreign Wars should support veteran access to medical cannabis through the auspices of the Veterans Administration hospital system. That resolution came out of Alexandria Post 3205 in 2012, was ratified by the 9th District with only 4 dissenting votes. It was revived by the Pikeville Post and was ratified at the state convention just a couple of weeks ago. It is expected to be ratified at the National Convention, and so I can say unequivocally to you that the Veterans of Foreign Wars Department of Kentucky supports veteran access to medical marijuana. As a senior advisor to Veterans for Medical Cannabis Access, I work with veteran medical cannabis patients in their dealings with the VA. Our director was a driving force in getting the Veterans Administration to issue a directive regarding veteran medical cannabis users. You guys, I think, have a copy of that. The Department of Veterans Affairs Veterans Health Administration Directive 211-4, access to clinical programs for veterans participating in state-approved marijuana programs, is a result of our efforts. Prior to this directive, veteran medical cannabis patients would have their medications withheld, or they would be denied care simply based on the results of a urine test. If you tested positive for medical marijuana, they would withhold your medications, they would downplay your treatment, sometimes it would be downright hostility. They sent me to the pain clinic. I got degenerative disc disease. I'm in constant chronic pain. And they sent me to the pain clinic. And the doctor that was there, she was very nice. And she looked at me and she said, well, we're going to put you on methadone because it doesn't have the euphoric quality of the other drugs. And I'm kind of a jokester, and I looked at her and I said, God forbid we should have euphoria when we're in chronic pain. She became unglued, started screaming at me, and I actually had to do the timeout sign to get her to calm down. You know, she said, I'm not a candy store, and I'm not going to give you all those pills and all. And I didn't want them. It seems to me, if we're scared of a little euphoria when we're trying to treat people in chronic pain or with post-traumatic stress disorder, then we're going down the wrong street. A little bit of euphoria is probably good for these guys. As a Kentucky veteran and a proud Kentucky citizen, I do support veteran access to medical cannabis. My post-traumatic stress disorder is from childhood sexual abuse. And so by the time, that happened around when I was 8 or 9, and by the time I was 14, I was a full-blown alcoholic. Because I would get Dad's bourbon from underneath the sink, and when I drank a little bit of that, everything was okay. All those nightmares and all those terrible people coming at me, that didn't happen anymore. But it only worked for a little while, and by the time I was 14, I was full-blown alcoholic. And that carried on when I got in the military. I got in the military when I was 18, and that was 1968. And in 1970, somebody turned me on to pot. And it worked, you know. I didn't have all that. But the problem was I was already a full-blown alcoholic. And I got to Germany in 1970. And in 1969, the law that made marijuana illegal was declared unconstitutional. So for a short period of time, between then and when Nixon declared the war on drugs, marijuana was relatively legal, and everybody in Germany smoked. I can't count the number of first sergeants I had tell me, I wish my guys would smoke pot and not drink, because every time they drink, there's trouble. Then Nixon come along and declared the war on drugs, and everybody got busted. Now, those of us who were suffering from PTSD and things like that, we were scared as hell to go back to alcohol. So, no marijuana available, and I'm in the barracks one day, and these guys are messing around with this white powder, and I said, well, maybe that'd be better than alcohol, and next thing you know, I was a heroin addict, right? That lasted about 6 months. Me and another guy locked ourselves in a room with a bunch of marijuana, and 4 days later, we weren't hooked anymore. It worked. So, you know, it was 6 months later that they sent me to the special treatment center down in Lackland. But I had been sober for about 6 months before they did. Anyway, they would lock you up down there, and during the day they would teach you about drugs and whatnot, and then at night at 6 o'clock they would let you loose to go to the bars. So all they did was drive us right back to alcohol. And I suffered with that until I was able to get sober in 1984. AA and using a pot as an adjunct when I was trying to quit, I hadn't had a problem after that. Alcohol, no problem with alcohol. But the problem is, you go to the VA, you tell them the truth, say, yes, I used pot for my PTSD. They say, we have to take away your medical treatment. So what the hell is that, you know? So anyway, the VA, I would go to the VA, they would test me. They say, I have to take away your medical care, and I have to take away your medicine and whatnot. And I asked the guy why, and he said because he was required to do it. So I asked him to show me the law that says he's required to do that. And he came back with the 1937 Tax Stamp Act, which made marijuana illegal, and I had to remind him that had been declared unconstitutional in 1969. And I had to inform him that what he wanted was a 1970 Controlled Substances Act. However, nowhere in the Controlled Substances Act does it say that he is required to withhold medication based on a positive urine test for marijuana. What they really wanted was the VA guide for opioid medication. And in the VA guide for opioid medication, it does not say required one time. It says it's up to the doctor. It's up to the doctor to decide what to do, whether to withhold medication, whether to take somebody out of treatment or whatever. And so,
Thomas, a 5-minute warning, okay? We got about 5 minutes
So
left in the
anyway,
meeting.
what we did was we basically got the VA to write a directive that stops them from doing that. However, if they had read their own regulations, they would know that it was not up to the bureaucrats to decide what happens to the patients. It's up to the doctor. And so what's happening right now is there is the VA person, she mentioned the study in Arizona. That's a Dr. Sue Sicily. She's doing a PTSD study, and for the first time in the 77-year history of marijuana prohibition, the government is providing the marijuana for that study. They've never done it before. The DEA approves it, and the study is supposed to go through, but suddenly there's a problem with the University of Arizona, so the study's on hold right now. The other adjunct to that is the preliminary information come out of the Medical Cannabis program being instituted in New Mexico. Veterans report an overall reduction of PTSD symptoms by 70%. I know that when medical marijuana is available to me, I have a 90% reduction in my PTSD, but I've been dealing with it for 55 years, so it has a lot to do with it. The other thing I want to mention is I also suffer from degenerative disc disease, and so it's chronic pain. Now, everybody talks about cannabis as a pain reliever. It's not so much a pain reliever. You get a minimal relief of pain. But what cannabis does is it breaks the connection between your mind and the pain. You get in so much pain, you can't think about eating, you can't think about taking care of yourself, you can't think about doing anything but the pain. And where marijuana comes in that instance is it breaks the connection between the pain and your mind. So you can eat, so you can dress yourself, so you can make the bed. You can't think about doing these things when you're in chronic pain.
Thomas, it's a good spot right there, if you don't mind.
Okay.
I do have a question, Representative Floyd.
Shoot.
Thanks. Master Sergeant Thomas Vance, I've been hearing from you for years in the email. It's glad to see you face to face. You have given us, or someone provided for us, 2011-4, the VHA form, or
Right.
policy rather. It talks about if you possess marijuana even for authorized medical reasons and you're on a VA facility that you could be prosecuted. Do you know if anybody's ever been prosecuted for that?
No, I don't. I've had some stories from guys where they had their marijuana on them and they got in a verbal confrontation with the security police and they got searched and thrown out, but that's about all. I hadn't heard anything, about them being arrested or anything.
And within Kentucky, do you know that of any who travel to other states where it may be authorized and have it prescribed for them medically?
I met a few people that do.
Okay, thanks very much.
See, no other questions. Thomas, thank you for your service. You've got just a few minutes if you want to wrap it up. Both of you, give you
Yes, sir,
a
if I
few,
could.
a minute apiece for a closing statement.
One
and-
thing, this back injury that the VA couldn't find anything wrong with my back with x-rays, et cetera. Back in 2009, I was in Laconia, New Hampshire. Could not kickstart my Harley. My leg gave out. It was numb around the knee area, cramping on the upper part of the right thigh. Called the VA. They said I probably had a stroke or blood clot. Go to emergency room immediately. 2 days later, I was back in Kentucky. I drove back here with my left foot on the gas. 2 months later, the VA did an MRI, so much for prompt service. But in the meantime, I went to the chiropractor, stretching, put white shoes on, could see where my right foot was at because I couldn't walk, I'd fall. Long story short, I did not do surgery, any drugs, never took the first pain pill. A year later, I found out I could actually run again. In 2012 and 13, I competed in a Wounded Warrior Tough Mudder in Maysville, Kentucky, the toughest one in the world, with 12-mile foot race up and down a hill, 25 Special Forces obstacles by the British Special Forces. You know, and I didn't need the damn VA drugs. The pain is intense at times, but sometimes you just gotta suck it up and say, no, you ain't destroying my life. My back still broke. It hurts every day, but I tell the VA, pain level, you know, I can deal with it. Let's just not throw any pills at me, you know. But the back injury that I had that they couldn't find anything wrong with, suddenly an MRI shows a broken back. So I know what the chronic pain is, and sometimes it can be so intense you would take a Clorox enema if it'd help. And, I mean, seriously, the pain is so intense you'll do anything for relief. I thank God that I'm not at that point now that I can survive what I'm going through and without, you know, any outside effects. But thank y'all so much.
Thomas, you.
Okay, I'd just like to say this. Medical cannabis access for Kentucky citizens and veterans is scientifically, logically, and morally justified. I hope the Assembly will move swiftly to make this medicine available as soon as possible. Additionally, I would suggest that we set aside a portion of the revenue for medical cannabis operations to support a fund to help veterans finance their cannabis needs. Medical cannabis therapy for PTSD in medical marijuana states can cost as much as $1,200 a month, and poverty should not keep these veterans from the medicine they need. Thank you.
Gentlemen, again, thank you for your service. Motion to adjourn. We are adjourned.